Well, we all know the signs of a heart attack, the pain in the chest and arm, but what is a foot attack? It's when arteries in the lower limbs get clogged with plaque, preventing blood flow and oxygen from reaching the lower leg and foot. It's painful, it's dangerous, and it's caused by the most prevalent disease you've never heard of, peripheral artery disease, or PAD. So here now is Dr. Jennifer Jones-McMeans, Divisional Vice President of Global Clinical Affairs at Abbott Vascular Business, here to explain what PAD is and to discuss Abbott's first of its kind dissolvable stent called Esprit BTK system, which is designed to help with the most severe forms of PAD. So doctor, good morning. Thanks for being here. All right, so explain a little bit more about peripheral artery disease and how prevalent it is.
Yes, well, you said it right. It is definitely the most prevalent disease that many people don't know about. It's estimated about 20 million people suffer from peripheral artery disease. And, you know, you talked about also a heart attack. We know the signs and symptoms of a heart attack, but, you know, there is the potential of a leg attack. And that's when basically the arteries outside of the heart and the lower extremities become clogged and blocked. And when there's clogging and blocking of those arteries, that limits blood flow and oxygen to those important tissues in our legs and our feet, which can cause the pain and the cramping upon exercise or even at rest that lead to potentially what we can call a leg attack or a foot attack.
So I have heard, and it wasn't until I was in this position and I talked to clinicians like you and doctors like you who talk about how important it is to look at your feet because it is such an indicator of your health. So what are the symptoms of this and how dangerous is a foot attack?
Well, some of the symptoms can start off of that when people are exercising or walking around, they can have pain in their legs. And this can subside after they've stopped and they've rested. But then it can progress, if untreated, it can progress to pain upon rest. So when they're resting or laying down, they're still having pain. Now, as the disease progresses and getting into its worst condition, there could be wounds that develop. And those wounds at times become very difficult to heal because you don't have proper blood flow down to the leg, down to lower parts of the legs, even to the feet and the tissues that supply your lower extremities. And so when that happens, these wounds don't heal. And at its worst case, this can lead to amputations.
And that's what I've heard doctors say, is that you get these wounds that don't heal, and sometimes people will ignore them or they won't see them, maybe because they're a little bit elderly, they can't get down there. That's why it's always really important to get those pedicures. But you've got Abbott's got a new dissolvable stent. So tell us about why this matters for people living with peripheral artery disease.
Yes, Abbott is very proud and pleased that the Esprit BTK system has been approved by the Food and Drug Administration. And what's key about this is that it provides a new therapy, a novel therapy, first of its kind, dissolving stent, that this field has not seen for decades. Currently, the standard of care to treat peripheral artery disease when it's done in a minimally invasive procedure is with balloon angioplasty. Now, what the balloon does is it goes down and it opens up the blockages and pushes the plaque back. However, it's not a sustainable treatment. And what can happen is that in most cases, the artery can close again. And when that artery closes again, that means the patients are coming back for retreatment. The patients are having the same symptoms again or similar symptoms. But Esprit is different. Esprit is what we call, again, a dissolving stent. And so it goes to the arteries that are diseased, where the plaque is, pushes the plaque aside, but it also has a drug. And this drug prevents the artery from closing up again. But also, because it is a stent for a temporary period, it keeps the artery open also by supporting it. But the artery does not need this indefinitely. And so what can happen is after about 3 years, the Esprit dissolves and the artery is healed. But actually what you've done, and we've shown this in our pivotal clinical trial, LIFE-BTK, is that it reduces the probability far more than balloon angioplasty of that patient having to come back and be retreated.
Well, that looks incredible. That's, you know, you always want to have something where you only go in once because it just reduces so many variables. This looks incredible. What should people do if they feel like maybe they have PAD or they want to learn more about Abbott's new stent?
Well, for people who number one, may have concerns if they have PAD, it's very important that they follow up with their physicians, have the discussions. There are ways to diagnose it that are very simple. Simple as blood pressure cuffs on the lower extremities that can help look at your pressures, and the physician can follow up and identify whether or not you need to be referred to more of a specialist. But for your viewers, if they are interested in just generally learning about PAD, learning about the Esprit BTK system, they can go to Abbott.com, or they can go to pad-info.com.
All right, Dr. Jones-McMeans, great information today. Thank you so much for joining us.
Thank you.
And